How would you, next question please, how would you determine if I have a cyst or an osteoma? Okay, so this is usually, I mean, you can get osteomas anywhere on the knee and all. So an osteoma is a bony lump. So the common place we see them is on the forehead. So lumps on the forehead. So first of all, a cyst is much more common than an osteoma. So if you've got a lump on your forehead, it's more likely to be a cyst or maybe a lipoma. So cysts and lipomas are more common than osteomas. So it's something we really need to see you and examine to see whether it is an osteoma. But in general terms, a cyst will kind of move. You'll be able to move it. And a lipoma will be movable like that, slightly different. A cyst is kind of in the skin, so you can move around the skin. A lipoma is kind of underneath the skin, so you can move it underneath the skin. If it kind of does not move at all, and if it's bony hard, you try and move it and it's just completely static, it's basically stuck to your skull, then it's an osteoma. And we can remove it, but it's just a bit more difficult to remove it because you need the instruments, and we've got to often go to the hospital for the instruments and stuff, but we can definitely remove it, and but it adds a slight level of complexity to things if it's an osteoma rather than a cyst. White on white, I should have black letters on there because I can't see it. So yeah, so it's just basically if it doesn't move, then the concern is it's an osteoma, and that makes it a bit more difficult to remove. So well, I won't say probably, we wouldn't be able to do that as a see and treat. If it's an osteoma, we would have to arrange to remove that at a different time and get the equipment and stuff. But if it's a cyst, yeah, we can do that as a see and treat, no problem.